about muscle contractions. Why do our muscles contract? To maintain a position, raise a segment or an object, or to lower or control a segment or an object. 3 types of muscle contractions: isometric, concentric, and eccentric. So let's get into it. Isometric, basically no motion, at least at the joint level. So there's no change in joint angle. Muscle creates an internal torque that resists the external torque. So just a reminder, every time we look at an exercise, there's a static equilibrium. That's usually how we analyze it, in static equilibrium. And so for this one, which is, I guess, a bicep curl, we have the external torque, which is an extensor torque. And the muscle torque or internal torque is a flexor torque. And those equal out, so there's no motion at the joint, and that's an isometric contraction. For a concentric contraction, a few things to keep in mind. The agonist muscle shortens, and that's a very, very rudimentary definition of concentric. Another definition is it opposes gravity, so you're lifting a weight. Another way to define a concentric contraction is that the muscle torque or the internal torque overcomes the external torque. So in the case of a bicep curl, our muscle torque, our biceps brachialis torque, overcomes the external torque of the dumbbell that you're lifting. Another definition is that the muscle torque or the internal torque and the joint direction, the motion, is the same. So in a bicep curl, the muscle torque, which is the biceps brachii, a flexor torque, and if you are flexing, that is a concentric contraction. Also, forces generated by the muscle are always less than the muscle's maximum force for a concentric contraction. Usually we oppose gravity, and an external torque and joint direction are opposite. So if you're going to have to decide, are you going to look at it in terms of internal torque or external torque? And we'll get into that a little bit later. So a visual. In this example, just know the external torque is an extensor torque. The internal torque is a flexor torque, always for a bicep curl. In this case, the joint direction, we are flexing. So the muscle torque, muscles can only pull. So the biceps brachii is creating a flexor moment or a flexor torque. The joint direction is elbow flexion. So if that muscle torque and the joint direction are both flexion, a flexor torque, and you are flexing, the muscle is contracting concentrically. Let's look at it from the viewpoint of the external torque. If the external torque and the joint direction are opposite, so in this case, the external torque is an extensor torque, and the joint motion is flexion, so you have extension and flexion opposite, then the muscle is contracting concentrically. So 2 definitions of a concentric contraction. Finally, we have an eccentric contraction. In this case, the agonist muscle lengthens, and it is also defined as controlling gravity, a negative, if you will. The external torque is greater than the muscle or the internal torque. It's typically a braking mechanism to control movement speed, so it usually happens during the follow-through. And the muscle torque and the joint direction are opposite. Eccentric contractions are very special because they can generate the same force with fewer muscle fibers. The majority of our normal activity, daily activity, is using eccentric contractions. And then, as many of you probably have felt, muscle injury and soreness are related to eccentric contractions. So a visual. Eccentric contractions, so the same setup. We have the muscle torque is a flexor torque for the bicep curl. The external torque is an extensor torque. And in this example, the joint is extending. So the muscle torque, again, muscles can only pull or shorten. So the biceps brachii is still trying to create a flexor torque. The joint direction is extension. So if the muscle torque and the joint direction are opposite, the muscle is contracting eccentrically. So you have a flexor torque and your joint is extending, an eccentric contraction. Looking at it from the external torque, the external torque is an extensor torque. We are extending. So if they are the same, the external torque and the joint direction, that is another definition of an eccentric contraction. And just to finish up, just some definitions. An agonist muscle is the muscle contraction causing the movement. Typically, multiple muscles are contributing to that movement. So for elbow flexion, you have the brachialis, biceps brachii, and then assisting muscles, brachioradialis, extensor carpi radialis longus, basically anything crossing the elbow joint in the anterior side. And an antagonist, the muscle action is that is opposite of the motion. Typically, it's always passively elongating or shortening, but the passive elongation we'll discuss a little later. Skillful movements have no continuous tension in the antagonist muscles. And again, typically the antagonists control or break actions and motions. Another one is a stabilizer. It stabilizes a joint, so basically it inhibits the joint from moving. Rhomboids stabilize the scapula during arm movements, which I'll show you an example of that. And another one is if you're lifting heavy weight with elbow flexors, it may cause your trunk to lean or flex forward. So the erector spinae would be engaged to stabilize that trunk during this motion. And here's a view of a stabilizer for the first example. The long head of the biceps brachii attaches to the scapula, so it'll pull the scapula anteriorly during the motion. So you engage the stabilizers. This little white person is acting similar to the rhomboids and the middle trapezius to keep that scapula from moving anteriorly. So it is stabilizing the scapula during this bicep curl exercise. All right.